Well, they're prominently positioned in pharmacies and health food stores right now, so-called natural products to treat cold and flu symptoms. Echinacea, garlic, vitamin C, zinc, the list goes on. But medical experts are warning now against the use of certain natural remedies, saying they could even be dangerous. Dr. Cindy Pan joins me now. Cindy, good morning. These are marketed as a natural way to treat cold and flu symptoms. The question, of course, is whether in fact they actually work.
Well, there have been a lot of studies on all these products, and there's no consistent evidence that they work. I guess they are over-the-counter, so patients can try them if they want to. They just need to be aware that there is the potential for drug interactions. It can affect the way other drugs work, other prescription drugs work, and there's also the potential for side effects. And in some conditions, it is possible it can make the condition worse.
What are the risks here? Why should people look at avoiding these so-called natural products?
Well, mainly if there's going to be an adverse reaction or if it's going to interact with the other medication that they're taking. That's probably the main risk.
Are there supplements that you think do actually work, that could be beneficial when it comes to treating things in winter like cold and flu?
Well, I suppose the thing is that supplements can help in the situation where you're deficient in that particular product. So, for example, if you're zinc deficient, ideally you would increase your dietary intake of zinc through, say, meat or other products that contain zinc. So I suppose that if you are zinc deficient, then taking a zinc supplement might be beneficial, but of course it'd be probably more beneficial to actually look at your diet and make sure it is replete with all the vital nutrients that you need on a daily basis, not just when you have a cold.
Yeah, good advice.
What about the over-the-counter options? Lots of people wrote in and asked about those, such as cold and flu tablets, cough medicines and nasal sprays. So we thought that we would ask Dr. Cindy Pan for us this morning for Health Matters. Morning to you, Cindy. Lovely to see you. Really, there is no, there's no cure to the common cold, is there? Is it just about relieving the symptoms?
Yeah, well, unfortunately, because a cold is a virus, we're really relying on our own immune response to get on top of it. So that's why it's always going to take a certain period of time. And we're never going to become totally immune to a cold because there's so many different viruses and different mutations of viruses and varieties that we'll never be immune to all of them. But instead of suffering the whole time, you can relieve your symptoms with a lot of different over-the-counter remedies.
OK, so on that, what ingredients should we be looking for?
Well, again, it sort of depends what symptoms you've got. So you just want to tailor your treatment according to your symptoms.
So let's assume that it's your common cold where you've stuffed up head, you've got a sore throat, you're feeling aches and pains, but you know it's not the flu.
Exactly. So there's a lot of simple measures, and a lot of them are completely harmless and pretty cheap. So nasal saline spray, you can use that even on babies.
Like a fez, something like that? Yep.
So it'll just flush out your nasal mucus, it'll thin the secretion so they drain a little bit more easily, and you really can't go too far wrong with that. You're not exactly going to get addicted to it.
Yep.
If you've got a bit of aches and pains or sore throat, I mean, paracetamol is a pretty straightforward medication. We give it to babies as well as all ages, and as long as you follow the instructions and don't take too much, you can't go too far wrong with that. If you've got a really runny nose, then a decongestant can be really helpful, but you just got to be aware of what you're taking. So, for example, if you're taking oral pseudoephedrine, the issue there is it is a stimulant, so it might make you have difficulty falling asleep, and again, you don't want to take too much. And if you use a nasal decongestant spray, you need to be aware of the rebound effect. So there's a condition called rhinitis medicamentosa, which is where people have this kind of chronic runny nose, and it's because they've overused those nasal decongestant sprays, and so they use it for so long that then when they stop, the nose becomes runnier than ever. So all these measures need to be used only short term. So we're talking about, a few days to a week or thereabouts, the length of an average cold. If your symptoms are ongoing, you definitely need to see your doctor.
Yeah, OK. And ongoing for how long? What is abnormal for a cold length?
Well, I guess, we've all had colds and flus, and depending on the individual, it's usually something between 7 to 10 days, and it'll be around 7 to 10 days, regardless of whether you take medicine or not. But when it's at its worst, it can definitely make you feel more comfortable. So if you're at home, blowing your nose and you're going through a whole box of tissues, taking a decongestant spray probably will give you some relief.
But send somebody else out to the pharmacy. Stay at home if you're sick. Thank you, Dr. Cindy Pan. Lovely to see you.